Hello and thanks for joining us. I'm Alex Redmond. Welcome to a new program here on METV. It's Your Suncoast Health. Now, Florida is #1 for beaches and oranges. But sadly, the Sunshine State also tops the nation's list of new HIV transmissions, and those are only the ones that we know of. We're here to explain how and why we are all affected by HIV and hepatitis C, and to offer hope is Community AIDS Network, or CAN's CEO and President, Rick Carlisle. We are also joined by CAN's Chief of Program Services, John Acevedo, and CAN's Peer Program Manager, Valerie Wojciechowicz, sandwiched here in the middle. Welcome to the show. How bad is HIV? Let's start with you, Rick, here on the Suncoast, and indeed in the state of Florida.
Well, in the state of Florida, as you mentioned, we're #1 in the nation for people living with HIV and newly diagnosed cases. And the Suncoast is unfortunately no exception. We see increasing numbers both from sexual transmission as well as IV drug use.
Can you explain how CAN's growth, because we are indeed growing, is tied into the numbers of HIV transmissions in Florida and possibly even beyond? How are we growing?
Well, what John and I do is we get monthly statistics from the state of Florida on newly diagnosed cases. And we look at the numbers that are increasing, and we call those hotspots. And so we then look to see if services are available for those patients. And if they're not, or the services are marginal, then we try to find a partner to work with and actually move into that area and take care of those people.
Can you break it down a little bit? Because we started off here in a little tiny clinic that was on East Street right here in Sarasota. Where did it go from there? Because you started just a couple of years ago and we've grown exponentially.
Yeah, we're a very mission-driven organization. Our mission is to not only try to prevent HIV transmission, provide a lot of educational services, which both Val and John do very, very well, but also to take care of people that we know that have HIV, get them in treatment, get their viral loads to a point where they can't transmit the disease. That's our mission. So our mission is to go where the HIV is, and now we've expanded that to Hep C and other sexually transmitted diseases, but you will continue to see us grow as the HIV transmission grows.
And we're opening soon in Palmetto.
We are. We're opening soon in Palmetto, and Palmetto will not be a place that we actually treat people, but we'll provide education, diagnosis, and then we send them to our Sarasota clinic to be treated.
John, how do we do this? Because we have different programs. Let's talk about the different programs.
Well, that's the thing that one of the first things, like Rick alluded to, is we look at the data. And from that data, we then determine the hotspots. And then as we determine those hotspots, we tend to look at the community and the needs of the community and what's going on within the community. It's once we formulate a strategy, then we try to roll out programs for the need within that community.
Can you talk about some of those different programs that we have with your outreach? You know, if you see the van out there and...
Sure. One of the programs that we have going on right now is the SNS program. It's a testing strategy that uses individuals' social network so that those individuals can bring their people within their social networks to get tested that they feel are high at risk. And then another program is working with our individuals that are infected and keeping them in care. And the way we do that is through Valerie's program, the peer program, where they mentor the clients in making sure that they deal with any barriers that the clients might have so that they prevent them from falling out of care. It's essential that the clients understand that they're not in this, they're not fighting this disease alone, that they have individuals and agencies that are here to help them every step of the way to make sure that they receive the care that they need as well as the support that they need so that they stay in care and live productive lives within our society.
And since you mentioned Valerie and the peer program, let's talk about how the peer program helps people that may have a new HIV transmission or somebody that wants to bring a friend in to speak, and how scary it might be for someone that's newly diagnosed, because it must be very frightening if you get one of these rapid tests, and you can explain that too. Who are you going to talk to? Not just a medical professional. Explain why the peer program is so important.
So the peer program is a group of individuals who are living with HIV, and basically what we do is mentor other people living with HIV. So I've been living with HIV for more than 31 years, so it stands to reason that when folks come in the clinic, if they're newly diagnosed, or even if they're not newly diagnosed, if there's something they're dealing with, either I've been through it, I've got resources for them, or somebody on our team has been through it. So we offer a unique program where people living with HIV can actually speak with someone who knows how they feel.
Let's talk a little bit about the stigma, because, and we can all, feel free to jump in here, because there is so much stigma surrounding HIV and HIV transmissions. People just don't really understand how scared people are to even go into a building that they know is conducting testing. So can you explain why it's so scary?
Well, the stigma out there is there's a judgment about us, people living with HIV. We are always those people. So when you ask someone about someone with HIV and you say, complete this sentence, she's living with HIV, there's never really something nice that follows after that. And we still lose jobs. We still get turned away from medical treatment. A lot of our clients have kids in school, and they're terrified that they're going to be tormented or treated differently within their communities. So it's big. Actually, I think the stigma now is worse than the stigma was in the 80s.
Correct.
You know, in the 80s, we were going to die in 5 minutes. So we're like, okay, I'll march on Washington. I'll speak out about this. But today, we live what we call a normal lifespan.
Let's go to John, because I'd like you to address the myths and the realities of HIV, because a lot of people think that, oh, you know, HIV is completely managed and AIDS is cured. I mean, people just don't really understand that it is still out there. Can you clear that up for us, please?
First and foremost, one of the biggest misconceptions within many communities is that HIV is no longer a problem. HIV still continues to be a problem. The problem is that you don't see a dying person on the TV any longer. You don't see a person infecting many people and it's national news. That's why it's to communities, they feel that it's no longer an issue. HIV is still a huge issue. We're seeing numbers like we've never seen before. And the reason why the state of Florida is now #1 in newly diagnosed individuals is because, granted, the state of Florida has a robust testing program. The state of Florida provides the most tests nationwide than any other state nationwide annually. Well over 500,000 tests that are done every year. And out of those 500 tests, we're having about a 1%, about 5,500 new diagnoses every single year.
Okay, but we know about certain numbers. We know what the numbers are, but there must be a percentage of people that may not even realize that they have an HIV transmission.
Correct, because to many communities, they feel that this is not an issue that I have to worry about. This is not an issue that I need to go get tested for, because I'm in a monogamous relationship, so they think they're in a monogamous relationship, but when they finally do come around and get tested, they find out that they're HIV positive. And we see that day in and day out when we have clients that come in to get tested, where individuals might be having multiple sex partners and not letting their spouses know whether that partner is of the same sex. You have a man that has sex with another man, but yet is married with children, and their wives don't know that they're infected or are having sex with another man.
Yeah, Rick, go ahead.
Just like to
Yes.
add a couple of things to what John and Val said. You know, when HIV and AIDS in particular were so prevalent, everyone assumed that this was just a gay disease. But let me tell you, and we're here to set the record straight, it is a disease that affects everyone, every population. both young and old. We have patients as old as 92, and we have a patient as young as 13. And they're patients, unfortunately, that are born with the disease, and we just don't, at the moment, take care of the PEDS patients. But that's the one thing, is everybody needs to understand that they are at risk. If they're single, having multiple partners, or you're sharing needles through IV drug use, you are at risk. And it's a scary thing.
Let's talk a little bit about seniors, because a lot of people think that seniors are exempt, but I mean there's the problem of people that could be in nursing homes, maybe there's dementia involved, and maybe he's knocking at the wrong door in the middle of the night, or in a retirement community. Recently we talked about in Ocala, the villages. I mean there's a huge number of STDs going on there. And possibly, can you give me a scenario of maybe somebody that is older, an older man that maybe has a girlfriend in his building, another girlfriend is taking Viagra? Could that contribute?
Absolutely. In fact, the little blue pill has, we believe, had a significant effect on the rise in HIV transmission in the older population. You know, the older population, they don't do birth control because they can't get pregnant anymore, and they think they're just risk-free. But all it takes is one individual that can actually spread the disease quite rapidly in a retirement community. The other thing I'd like to say is, you know, the scariest part of this disease to me is the first, some of my docs say up to 10 years, 5, 7 to 10 years, you have no idea you have this disease. You have no symptoms. You know, you're as healthy as we are, and so when they find out they have HIV, they're absolutely flabbergasted because I feel great. But that's the scariest part, because that's when the disease is being transmitted to other people, other individuals. And
possibly you might not feel those symptoms until it's so far into it that it might have progressed to something a little worse than HIV, which, you know, brings us up into, let's clear it up about the difference, Valerie, between HIV and AIDS, because people do think that they are one and the same.
First, I'd just like to expand on what Rick said. So people who are living with HIV but not getting tested, they're not getting tested because they feel fine. They don't even know they're at risk. The other problem is that our education, folks can recite back to me that someone living with HIV looks just like you and me, but then when I disclose my status, they're all shocked because I'm supposed to be skinny with sunken cheeks, and they believe that they can tell by looking at someone.
I would like to ask, this is kind of an important question. When you say to somebody that you've been having a normal everyday conversation with, I have HIV and I've been living with HIV, what is the body language that happens to someone that maybe doesn't know that, or doesn't understand that you can't get it from a handshake or a kiss or a hug? What's their reaction sometimes?
Always they say, oh my God, but you look great, or I could never tell because you look great. And that, I think, is one of the most important messages we can put out there. You cannot tell by looking at someone if they have HIV or any other STDs, and quite often they don't know themselves.
Let's talk a little bit about if somebody doesn't, is there so much stigma that somebody might be nervous about disclosing their status, and then we have a lot of people that are walking around with HIV transmissions. That could be your doctor, it could be your dentist, and we'll talk about the difficulty with getting a dentist when you have HIV a little later in the show. But is it possible that all these people have HIV and they're not disclosing it? So it could be your teacher, this and that, because they're so uncomfortable sharing that information because of the way people perceive it and the misconception.
Absolutely. People still, you know, sometimes people take a step back. They're not aware that you can't get this disease from casual contact. Kaiser did a survey a few years ago of adults living in the U.S. and their perceptions about HIV. 25% of them thought you could get HIV from drinking out of a glass. 14% of them thought you could get HIV from a toilet seat, and 17% of them thought you could get HIV from a swimming pool. So we wonder why folks are so afraid to be around us. It's because they're not educated about routes of transmission and what HIV actually is.
Did you want to add to that, Rick?
I want to add to something that Val said about people that know they have HIV, but they're not in any form of treatment. And this is very, very unfortunate, but John and I see that when we look at hotspots, almost half of the people, almost 50% of the people know they have HIV and are not in treatment. And that's almost everywhere we go in the country.
And what is the concern, John, about if somebody does have HIV and they're not in treatment because they're scared to get treatment, what's going to happen to them? And also, let's talk about the possible numbers of transmissions that could go up because of that.
Well, first and foremost, if they're not in treatment, they have the chances of them infecting someone else are that much greater. Being on treatment then lowers the possibility of that individual transmitting the virus to another. Granted, we don't want them to transmit it. You know, even using the condom would protect others. However, you have some people that are out there that are still engaging in high-risk behaviors and infecting others. Not being in reasons for not being in care. Look at the communities that they're in. We have one of our highest counties in the state of Florida that had highest numbers. You have 28,000 individuals that are infected with the virus, but only 12,000 of them are in care. That means that 16,000 individuals within that county are not in care. So where are they? What are they doing? Why is it that they're not in care? These are questions that we ask ourselves. And knowing the communities, you know, you have high African American, high Hispanic communities, that these two minority communities are where stigma tends to flourish because of the way the family is, the way the community is. And when you have high numbers within both communities, you know why they're not in care is because within their community they feel they're going to be ostracized, discriminated against, and the stigma is going to continue to put them at risk.
Let's go to Valerie for this one, because you are so hands-on with your peer program, working with people that are newly diagnosed or people that are living with HIV. And you've seen people within the different communities. And in fact, we've even talked about how different people won't seek treatment or how nervous they are. Let's talk about first the African American community, because you do have some people that have shared with you the challenges of being residents of that community. Why are they so worried?
And what's really sad, Alex, is I know people who've been living with HIV for 15, 20, 30 years and have never told a single soul. Because society stigmatizes us, and then we further stigmatize ourselves in many cases. And in the African American communities, I once asked somebody about this, and they described it to me as the barrel of monkeys. You know, when one person tries to climb out, everyone else jumps on to bring them back down, and HIV is the same way. So it gives people something to talk about.
When you explain the barrel of monkeys, is it that let's give a scenario as like church? You know, it's a place where somebody should feel safe. But in a church, we also know that the church can be a very gossipy place as well, because everybody knows everybody. So what's the concern there?
It's heartbreaking, because the place people go where they should get the most acceptance, the most love, the most support, is the place that they are most terrified will find out about their HIV status. What if anyone in church knows? We have a group, a support group, and some of those folks go to the same church, and they won't even talk to each other because they're afraid somebody's going to figure out. I mean, it sounds crazy, but the fear and the stigma surrounding this disease are still so horrible, it keeps people down. We have clients that when they pull into our parking lot, if they see a car they recognize, they pull right out of the parking lot. Their words, we haul butt out of the parking lot. They'll skip their doctor's appointment because they're afraid they're going to see someone there they know, even though at our clinic we have mental health services, dental services, we do testing. You could be volunteering, you could be picking up condoms. There are lots of reasons someone not living with HIV could be in our clinic, but because society puts that stigma on us, we are terrified that anybody will find out.
Rick, did you want to explain, because you came here, you felt compelled to come to CAN and help CAN grow to accommodate the growing number of HIV transmissions?
Yeah, one thing I want to mention is what Valerie was saying about the African American community and churches. You know, it's a double-edged sword. We know that church members do not share their status with other church members in most cases, but we also know that in the African American community, more than any other race, the church is the avenue to get things done. So let me tell you what we've done. Down in Miami, as an example, we have associated with an organization called the Family Foundation. It's run by Reverend Baxter. They've been in business for a number of years. The interesting fact is all of the board members of the Family Foundation have been personally affected by AIDS, actually AIDS. And so they're very passionate about the work they do. We were very surprised to find them because they have been active in providing education, testing for their congregation, and they've also grouped churches together. Now there's 36 churches, African American churches in Miami-Dade that's part of the Family Foundation.
Do you think that by them joining forces with other churches and making HIV and AIDS more a part of the conversation, that we are destigmatizing both HIV and AIDS and making it a normal part of the conversation?
Yes, we obviously are. Unfortunately, that's not the norm everywhere else. We do have a very active board member, African-American gentleman named Demetrius Jafunza. Demetrius has met Reverend Baxter with me and now wants to take that same model to Sarasota, to the African American churches in Sarasota and elsewhere around Florida. And I think that's wonderful because that'll help get into the African American community much better than we are today.
Because you've been in Sarasota quite some time, and we're going to talk about your little history and where you came from to now. But how would you describe Sarasota when, in comparison to Miami, when it comes to being somewhat conservative? And you know, we're happy to love the arts and culture and this and that. But when it comes to speaking about things behind, you know, closed doors, we're bringing them out in the open, like HIV and AIDS.
Well, I'll give you the best example. In Miami-Dade, the school system is very active in providing HIV education. Unfortunately, in Sarasota County, we are prohibitive from going into the school system and sharing this information. Now, one or two principals have allowed us to have a display at certain events, so that's a good thing. I've talked to several principals about that, and John's working actively trying to change those dynamics.
John, let's talk to you then about how challenging it's been to get into the school system, and what can we as a community and people that don't want our children to come home with and say, Mom, Dad, Grandma, Grandpa, I just found out that I'm HIV positive. How can we best prevent this by getting into the schools, and what are you doing?
Well, first and foremost, we have to look at the disease itself. How long has it been? It's been, what, 33 years since actually 36 years for the disease now? And the way the virus, when we first found and were made aware of the virus back then, it's not what we're seeing today. The same thing goes for the people and the students in the school.
You mentioned the virus is not now what we were seeing then. Can you explain that?
Correct.
Please.
Individuals, when they were diagnosed, like Valerie alluded to earlier, when they were diagnosed, within anywhere between 3 to 6 months later, they were no longer existing. They passed away. With many of the advancements today, individuals are surviving many, many, many years than they were in the past. So you take the way the virus is now and the advancements in the combating the disease, and you try to apply that in the school system. Well, a lot of people, a lot of kids in the school did not see those individuals that were infected and dying with the disease. So now what they're seeing now, they're seeing people thriving with the disease on medications. To them, you take one pill, it's just a chronic disease, take one pill and you're fine, not a problem, you can live with it. Unfortunately, that's not the case. You know, we have to look at the costs behind it and all that. So, but educating, having a robust education program, comprehensive educational program where it encompasses, yes, abstinence is one of the components, but we know that abstinence alone is not going to stop the continuous spread of the virus.
You know, abstinence is something that many people practice and many people advocate for their children to be abstinent until the time is right. But perhaps Valerie gave a great analogy about playing in traffic. It's not that people are encouraging their young ones to go out there and have sexual relations. The thing is that very few times in life do we ever plan for the first time.
Right.
And HIV can indeed be transmitted in a first time close encounter. So what was that analogy, Valerie, about the traffic, playing in traffic?
So I've been speaking in middle schools and high schools in Sarasota County and Manatee County for 15 years, and so have a lot of our other peer navigators. And it's awesome because the kids are really receptive to us, but we are not allowed to talk about condoms, and everyone gets so up in arms about what we're going to say. We went to one school, and there was a panel of us, and a woman came. She was the liaison to the parent teacher something, and she's like, okay, you guys, you can't talk about sex. If there's questions about sex, direct them to the school nurse. You can't talk about condoms. If there's questions, direct them to the I mean, it was so over the top, and what the kids really want is for someone to be honest with them. But what adults think is that if we talk to them about sex or if we talk to them about condoms, we're encouraging them to have sex. And I tell the kids that, and I ask them, does anyone really feel like I'm walking out of here encouraging you to have sex? And they're all like, no, we're not going there. But the analogy that I use is we teach kids to look both ways before they cross the street. That is not encouraging them to play in traffic. If we teach them about the risks of being sexually active and teach them about condoms, that's not encouraging them to have sex. It's just making sure they can look both ways before they make a decision. And we know that teenagers feel like they're invincible, that they're not necessarily going to make the best decision. So when they're in that moment, that's not the time where they should be learning about a condom. I feel like they should know about them. They should have tried them. They should not have to be even thinking about it at that point.
Yeah, I love the analogy of crossing the road, because you're not saying go play in traffic, nor are you saying just by talking about things that will keep you sexually healthy and stop you from getting not just HIV, but other STDs, getting pregnant, hepatitis C. And basically, if you give people the tools and they have them on hand when the time is right. Because most of us sitting at this table, and indeed here in Sarasota, Manatee, and beyond, know that the first time is very rarely planned for. So I think that's a great analogy. Yeah, Rick, go ahead.
The other thing, just to add to this, is of the two groups that we're really seeing in the state of Florida, a very significant increase in newly diagnosed cases, is the over 55 citizens as well as the youth. So what Valerie and John are talking about, and when we're talking about providing education to those groups, it's extremely important. It's extremely important, as Valerie said, to be very honest with them, be very straightforward. Don't try to, shed any responsibility or mask what the real problem is, because those are the people that could end up getting the disease for lack of information. And we need to be honest with people.
And of course, CAN has a group of people that will go out there into the community, to community centers, to schools, if you wish, to nursing homes, retirement homes. And of course, if you would like CAN to come and visit you, you can go ahead and call this number. It's area code 941-366-0461. Is that, yeah, 366-0461. And then you can have somebody come out there, and there's also a website that you can go on to, which is cccSRQ.org. Again, that's cccSRQ.org. And they'll arrange for somebody to come out and educate people. And of course, let's get back to the seniors, because I think that's very interesting. You would think that it would be very easy to go into a senior center, because we're saying, no, you can't have sex education in the schools. Maybe that hopefully we'll start to be able to implement that to keep our children safe. But what are the challenges about trying to get into a nursing home or a retirement center?
The challenge that you said, trying to get into the centers. We've called numerous centers to go and give educational information to those who are in centers. The nurses, the personnel, well, they're not having sex here. Well, we know that's not true. Unfortunately, CAN We have our oldest diagnosed individual is still living, 92 years old. He was diagnosed back about 7 years ago. And this individual, like all the stories that we've heard, is that he was he was married, his wife died, wanted to get back into the scene, and unfortunately he sought out a prostitute, and he was infected via a prostitute. And then when he finally came in and got tested, he was diagnosed with HIV. So it is out there. Our seniors are engaging in sexual behaviors. It's something that's natural. However, they're putting themselves at risk because the educational material is not for them, so they think. A lot of the materials don't have the face of a senior. They have the face of a young person, so it's not their disease.
If my father were still alive, my father would say that as a senior, he'd earned the right to do whatever he wanted to do. And if he wanted to go out there and have a girlfriend or two, he would absolutely do that. But my father was also the type of person that would protect himself, because he unfortunately died at 78. He would have loved to have lived a lot longer, but he would have loved to have stayed healthy for that. So why are we treating our seniors like children? Have they not earned the right to go out there if they want to be intimate with somebody and do it safely? Why aren't we giving them the protection that they might need to stay safe?
Well, it's too double-edged. If they're in a living facility, assisted living facility, those that the gatekeepers into the facility are preventing us from giving the information, as well as those out in the community. When we do give them the information, all they can say is, well, this is not really for me because I'm not doing those things, or the education is not for me. It's more for a younger person because I'm not engaging in that risk. But in fact, we're seeing that they are, and the numbers are telling.
And of course, the numbers, getting back to the numbers, we actually have a map that will show you of the numbers of transmissions that are throughout Florida. And that map is, we have one of them by AIDS View, and then we have something else from the health department. What is it about those maps, though? I mean, it shows quite a few numbers of transmissions. However, those maps are not current information. How often do they come out?
Well, the maps come out. They're updated about every 2 years. Right now, we're seeing 2014 numbers, and the states should be submitting all their information and getting those maps updated. The unfortunate thing is that we don't have real-time data, because once individuals are tested and states collect the data, they have to massage it and clean it up, then send it to at the federal level. They clean it up and make sure that they're not duplicated numbers from other states, and then they finally report it. And it takes an average of about 2 years that we're seeing. But the numbers that we currently have are still alarming, because it shows high numbers throughout the state of Florida and also nationally, especially the southeast part of the country, where it's always been a hot area in the United States, where we have high minorities, we have high drug use, as well as high HIV transmission rates as well.
You know, if your dad was alive and I had a chance to talk to him, here's what I would say to him. Enjoy yourself, protect yourself, know your status, know your partner's status.
Yes.
If you did that, you can enjoy a full life.
The other thing, Alex, is that people think that I've so many times had people say to me, well, I don't sleep with those kind of people.
Yes.
Yeah.
Or I don't sleep with anyone who looks like that.
Right.
There is no look. There is no certain kind of person. If we talk about a sex worker, you know, everyone thinks that that's the place where you get it. But I feel like because that information is what's so mainstream, people feel like the rest of the world can't be a detriment to them.
We recently saw a film at the Sarasota Film Festival that CAN was a sponsor of, that KT Karan, the local Sarasota filmmaker, did. And it was really compelling. It was called The First Time Club. And how did that touch your heart, Rick? It was a very sad film. What was it about?
What it's about is these 4 youth that form a bond, and they cut their fingers and they share their blood as the bond, and they started when they were young, 8 or 9 years old, and then the film follows them as they get into their teenage years. Unfortunately, one of them becomes infected with HIV, and the way the others find out is she won't share the blood anymore. And so it sends a very strong message to the youth of our community about the transmission of the disease.
I think it was interesting too, though, because in the film, I actually went to the screening with you, and the one thing that I think surprised the audience the most was the person that you thought, like the child, the wild child, was going to be the one that came forward having an HIV transmission. But it wasn't that child. It was the other teenager who was like the good little girl that, you know.
That's unfortunate, but unfortunately, that happens in real life on a daily basis.
Mm-hmm.
Why are you so compelled, Rick, to work with people with HIV and hepatitis C and all of these things when, I mean, you came from a big hospital. What was your background?
Yeah, I was vice president at Sarasota Memorial for 15 years, and actually while I was there, I became the administrative liaison for a newly found organization called Community AIDS Network. And the reason Community AIDS was founded, and it was founded by a very, very strong group of volunteers, as well as it was funded by the local governments, including Sarasota County Public Hospital Board. But the reason is because when I was at the hospital, and they were AIDS patients, our infectious disease docs didn't know what the disease was initially, as people around the country and around the world had the same problem. And we segregated these people on one floor. We had a special group of housekeepers that would work on that floor, dietary workers, and of course the physicians and nurses that were true pioneers in working on these people. Because quite honestly, when it first came out that it was a real disease and was not going to go away, people had no idea how it was spread. So it was a very scary time, but we also recognized as a hospital that these people needed long-term care. We could not keep them in the hospital and effectively treat them. So one of our key physicians, Dr. Jeffrey Stahl, became the medical director, the first medical director of Community AIDS Network. And he and Susan Terry, who was the first executive director, had such a passion about delivering care to those people. That's how we started.
So it's grown exponentially from that little storefront on 12th Avenue. What is your vision for the future? Where would you like, or where are you making the strides right now, because you're doing it?
Well, as I've said earlier in the interview, you know, we look at the hot spots of HIV transmission. We look at what providers are there, what organizations are there to serve those individuals. And if there's a gap, we try to go in and fill that gap. We do that all around Florida, and now we're looking outside the state of Florida. If you look at the HIV prevalence map for all of the United States, the southeast and the northeast coast are very, very high rates. So now we're looking at those states to actually grow as well, because again, we're mission driven. Our mission is to find the people that are suffering from this disease and get them in care, and also provide education to the population in general to try to keep the transmissions from increasing.
I think it's really important to talk about treatment and what happens to somebody if they don't know that they have HIV, that they have an HIV transmission, and it goes on for a long time. How will the treatment vary from if you find out at the early stage, if you get tested and you find out, okay, you know, I had relations recently, or, you know, maybe I was partaking in an activity that could put me at risk, then you find out that you're positive soon rather than later. How does it change, Valerie?
It's much easier to keep a healthy immune system healthy than it is to get a broken immune system, excuse me, a broken immune system well. So when you find out early on, and a lot of times, again, people say, well, you know, I don't feel any different. I had this virus in my body for at least 5 years before I found out. I had no clue that it was there. I was 28 years old, teaching 15 aerobics classes a week, the healthiest person I know. I had no idea this virus was in my body, but fortunately when I found out, my immune system was extremely healthy, so I just have to keep it there. Other folks, when they find out if their immune system is really compromised, we have to get them healthy, and the damage that's done down here really never gets better to the same degree.
One of the things that I think we should really talk about, though, is a lot of people think that because HIV is now managed, that if they get a diagnosis, they can just take one pill a day and it's going to take care of it. So how does it differ from somebody that maybe has been living with HIV for some time? What are the differences in the type of treatment that they could take with an early diagnosis as opposed to later?
So if you're diagnosed early, quite often you can take one pill once a day, or you can qualify for studies that are injectables that are once a month with the goal of being annual injections to manage HIV. But for those of us who have been dealing with this for a long time, or if somebody is not adherent to their medications, our body learns to outsmart the medicines, and that makes treatment a lot more challenging. The other thing is that, yeah, the news is great. A lot of people can take one pill once a day, and we live what they call a normal lifespan. But in no way, shape, or form is this a normal life. I can tell you, after 10, 15, 20, 30 years of taking medicine, doctor's appointments every day, fighting with insurance companies, everything that goes along with a chronic manageable illness, it gets old after a while. So what we find is that folks, even though the medicines are available, don't take them because it is just too much.
Adherence to medicine. We'll go to John for this one because we have a real problem with people adhering to taking their medication. They take it for a while, maybe their viral load goes down to undetectable, and we'll talk about that too. But why is it so dangerous to stop taking medication?
I think Valerie hit the nail on the head when she said that, you know, our bodies tend to change the way medications work with it. The virus is a very, very smart virus. And if you stop taking the medications, on average, maybe about, let's say, 5% on a given month, 5% may be anywhere between 1 or maybe 2 treatments a day that given month. The virus finds a way and mutates where that medication that you're taking, it's no longer effective against the virus in fighting it. So that's why it's crucial when the doctor tells you to take a medication as prescribed, there's a reason for it. You have to take it as prescribed, or else you're giving the virus a leg up to try and find ways around that medication. And if it finds a way around that medication, there's potentially, if it's a combination, then it's potentially you're resistant to a medication within certain other medicines as well.
So Valerie, it's not unlike then an antibiotic, where we hear of antibiotic resistance a lot and people build up an immunity. But also, let's talk a little bit about some of the side effects that come from taking all these other medications, because recently we had a colleague of yours, Debbie Sergi-Law, who is also a peer navigator, disclose that she brought the amounts of medication she takes in a day. She literally brought, it was more than 20 bottles of pills that she takes on a daily basis, with an alarm that rings 5 times a day on her phone to remind her to take them. Is this what happens if you don't get diagnosed, you know, in a timely manner?
It could, and it could also happen even if you are diagnosed in a timely manner. The medications do a great job at managing HIV, but the side effects can be debilitating. And also, you know, the stigma plays into this, the mental, emotional, and physical parts of this. It gets really old after a while. And so the side effects that come along with the medicines, and people who don't live this life are like, it's just a pill, take it, what's the big deal? And I'm like, okay, hang on one second. Let me tell you what all the big deals are. So taking any medication over an extended period of time causes damage to other things in our bodies. The most common side effects are nausea, vomiting, and diarrhea. I have joint pain and body aches that just won't quit. Headaches, fatigue. Fatigue is, it sounds like tired, but I can get 10 hours of sleep and I still wake up exhausted. When you feel like that all day, every day, you're trying to work, get kids to school, whatever your life is, it becomes really difficult to also take a medicine that's going to make you feel worse every day. Some of the side effects that Debbie was talking about, it changes our bodies. Some of the medications cause weight gain, so people don't want to take them. Some of the medications cause different fat redistribution in our bodies. There is so much to take into consideration, and of course, sometimes it can cause weight loss. And back to when we were talking about the African American communities, in some communities, if you lose weight, even if you're trying in a targeted way, they think you're sick. So there's so much. It's not just take a pill and go on about your life, which is what young folks seem to think. There's so much more that plays into that.
John, is there as much of a stigma within the Latino community as there is the African American community? Because from what I understand, it's not even the same wording, like we call it HIV, but in the Latino community, it's VIH.
VIH.
So does it lose something in translation? Is it?
No, not at all.
No?
It's the same. Understand that like African Americans, minority communities, there's lots of stigma and discrimination within their own community. So the minute someone within their relative or within their community is infected with HIV, they're going to be discriminated against. And then you take into consideration if that person's lifestyle is a problem, like if they're gay, homosexual, or engaging in IV drug use, then it becomes that much more of a discrimination within their own community.
So it's very important to get the word out there. And again, if you would like Community AIDS Network to send somebody to your community center, school, possibly to a group of people, because perhaps the migrant worker population, maybe there's a group of people that need information that should be tested, you can go to cccSRQ.org. Again, that's cccSRQ.org, and reach out to John Acevedo. He'll set something up for somebody to come out and speak, whether it's a school, again, a community center, or any group of people. And John, I would say that this is your golden opportunity, because we do have a number of people here where English may be their second language, but also perhaps they don't speak any English at all. So I would say that this is your opportunity to just go ahead and say it in Spanish so we can reach further into our community here in Manatee County and Sarasota.
Sí, nuestra agencia se llama Community AIDS Network, es una agencia de educación de VIH. Damos tratamiento sobre VIH, tratamiento sobre la hepatitis A, B y C, y también enfermedades que son transmitidas sexualmente. Si quieres información, educación sobre cualquiera de estas enfermedades, si quieres, puede comunicarse con nosotros el website, el correo electrónico sobre cccSRQ.org. Entonces, o puede llamarnos al 941-366-0461 y se puede comunicar conmigo o cualquier otra persona que trabaja en el departamento mío, o cualquier persona dentro de la agencia lo puede ayudar.
Well said. I couldn't have said it better myself. I think that one thing that we should probably let people know is that if you want to get an HIV test, that it is incredibly important that you know that getting a test is really, really simple. It's just a little pinprick. And I believe that now we even have tests where people can come in and they can get the results pretty fast, yes?
That's correct. 15-minute test. They can get a result on the spot. And sometimes if we, depending on how the interview goes or the counseling session goes, we might want to do a blood draw just to confirm the findings on the test on hand, which we feel it's a benefit to the client, because if there's a question or they might have put themselves at risk recently, that confirmatory then lends to the credibility of, not so much the credibility, but the test that they just had, in making sure that the findings are correct.
Valerie, I think that perhaps you might want to share something that happened at a recent testing we had. I think it was either in Port Charlotte or Englewood, where we had two young men that went there and one was urging the other one to get tested. Can you explain that scenario? Because it would be interesting for our audience to know what can happen.
I wasn't actually there doing the testing, but what happens with me as a peer navigator, I am the first line when somebody tests positive. There's an immediate phone call to me to talk to them. Even in 2017, their first question is, when am I going to die? Their second question is, how could this happen to me? And so I go through with them education just about where they are right now, and just how to get them through managing with this emotionally until they can actually get to a doctor and find out what their body is doing.
Because I would imagine that it's like hitting a wall when you first find out that you're HIV positive. What was life for Valerie like before HIV, and then the moment you got your diagnosis, what did you feel?
So it's hard for me to remember life before HIV. I've had it for so long, and pills, insurance, dealing, stigma has been my life for so long, I can barely remember that. But I remember getting the results and just being paralyzed. I couldn't think, I couldn't move, I couldn't anything, and this was before the days of cell phones. To this day, the single hardest thing I ever did was go home and tell my husband I had HIV. Disclosing to people is terrifying even in 2017.
Do you find that close relations, husbands, children, parents, is it possible that they would even shun somebody once they find out that their relative has HIV?
So on Mother's Day, a friend of mine said to me, I would love to call my mom and wish her a happy Mother's Day, but she disowned me when I told her I have HIV. Unfortunately, we still get turned away from medical treatment, we still get fired from jobs, dating is an absolute nightmare, and families do still respond that way sometimes.
John, I want to ask you something about our medical services because, again, CAN's medical services are so important. The stigma of even trying to go to a dentist, very often I have heard that some dentists may turn away a client or a patient because they know that they're HIV positive. Why is that, and what do we offer?
Well, yes. First off, yes, we do provide dental services at our facility. We're a one-stop shop facility. Medical, dental, mental health as well. But yes, what we're seeing is that dentists, local dentists might not accept clients that are HIV positive or even infected with hepatitis because they fear of the possibility of there being a transmission.
So is this one of the cases then where people are scared to disclose their status, so they're not disclosing their status, so then the medical professionals won't even know who is HIV positive, or in fact, it could be the patient or client where it's the medical professional that's HIV positive, but
Correct.
because of stigma, they're not going to disclose it.
That is correct, and that's what we're seeing. Clients should be disclosing to medical professionals when they're going to receive services in a questionnaire when it's asked. However, what we're seeing is individuals are not reporting for the fear of being discriminated against and a service not being provided to them. We see it day in and day out. As we're trying to expand our dental services across the state of Florida, we're seeing that where providers do not want to provide dental services to our clients.
Rick, it's not just HIV that we treat over at Community AIDS Network or CAN. We're actually making great steps with diagnosing different liver disease. Can you explain the little portable machine that we have that CAN takes to different locations?
Yeah, we invested in a machine called a FibroScan in the fall of last year. And what the FibroScan allows the physician to do is through an ultrasound device, actually diagnose the liver, how much fatty liver they have, if they have any cirrhosis, basically the wellness of the liver. It is a amazing inroad that we have now undertaken because we're seeing a significant increase in the number of people coming in and getting the FibroScan, and then if they do have Hep C, getting into treatment. Because Hep C is like HIV. Well, a lot of people that have Hep C have no idea they have it.
Final thought, Valerie.
So I want to go back to what John was saying. So many people living with HIV don't disclose to their medical professionals because many of us have had our confidentiality breached. Even though it's illegal, it happens on a regular basis. I have a client whose primary care nurse disclosed her status to her entire, she lives in an apartment complex. It's illegal, but we don't want to stand up and fight those things. We don't want to go through anymore, so we tuck our tails and run away.
Perhaps we need to take a page out of what happened many years ago when people did stand up. It's difficult, but collectively we can change the way people think about people that are living with HIV. and make changes, because without a bunch of very brave people standing up years ago, that research would have been halted.
Yes.
So, you know, maybe we need to do that again, because of course we don't want to be part of the generation, or the younger generation in particular doesn't want to be part of the generation that stood for absolutely nothing. So I think it's something that we need to stand up for.
Yes.
That's why I speak out publicly. It's not always easy. I'm sitting here wondering, actually hoping that my neighbors aren't watching this, because I live in a really small community. And as public as I am, it still affects me sometimes in those ways, believe it or not. But I want to thank you and METV for having us here, because this is important information to get out there, and I don't want to talk to one more person about what their life is going to look like now that they're living with HIV.
Correct.
And of course, if you want to reach out to Community AIDS Network, it's very simple. All you have to do is go online, cccSRQ.org. And perhaps next time someone does trust you enough to disclose their HIV status, instead of taking a step backwards, maybe what you want to do is take a step forward and give them a hug, because you can't catch HIV or an HIV transmission from a hug. And there are simple steps that you can do to protect yourself and your loved ones. And it starts with common sense. First of all, get an HIV test. It's just a pinprick. Get diagnosed and get treated. And prevention is easier now than ever. And again, for more information, you can go to CAN's website, cccSRQ.org. Follow us on Facebook, and thank you, Manatee Educational TV, that's METV, for helping make this program happen. I'm Alex Redmond, and thanks for watching.